Hello, this is Dr. David Green, CEO of the California Pain Network. The topic today is what you need to know about spinal cord stimulator implants. Spinal cord stimulator implant is a revolutionary device that is permanently implanted around the spinal cord in an effort to provide pain relief to chronic pain patients. The newest ones work well for either chronic back pain or leg pain. There's also indications for arm pain. A spinal cord stimulator is considered a last resort treatment as it does involve surgery. It's extremely expensive to insurance companies. And the main thing is it doesn't fix the problem that you have, okay? But if the problem cannot be fixed, then it does a very good job of masking pain. Who benefits? This is not a first-line treatment. This is a last resort. It doesn't fix the chronic pain problem. As mentioned, it simply masks pain. But it's great for those who have failed back or neck surgery syndrome and don't have an indication for further surgery, postlaminectomy syndrome, RSD or CRPS, diabetic or peripheral neuropathy, and it's becoming a great treatment for people who have things like chronic recalcitrant pelvic abdominal pain, testicular pain. What can a spinal cord stimulator do for chronic pain? It can take a person with chronic pain, depression, and inability to work and completely turn their life around. It's been shown to work well, like I said, for back, neck, arm, and or leg pain. You do have to have a trial place first, which is a low-risk procedure just to see if it's going to work. And it can decrease the need for narcotics. So the first phase is a trial implant. It's percutaneously placed. The person is awake while you're putting it in, just sedated, so that they can answer you. If the surgeon, the pain doctor puts it in, the patient says, aha, you turned it on and now I can feel a tingling type sensation where I was having pain before, then you know it's in the right position. So the leads go in around the spinal cord, but it actually comes outside the skin. There's a sterile dressing placed, and it's attached to an external battery pack / programming device. Okay, it's worn 5 to 7 days to see if it's going to work well. If you get over 50% pain relief, then the person goes on to the psychological evaluation before the final implant is approved. How is the final one planted? This is put in completely under the skin. It takes about an hour to do, and what you end up with is the battery pack / programming device under the skin subcutaneously, and 2 leads that go on either side of the spinal cord that then provide electrical sensations to change the way the brain perceives pain signals. It does require an incision and a bony removal to be able to get these leads underneath. Okay, and then the leads are tunneled underneath the skin, to the area where the battery pack and programming device is placed. The latest programming devices have over 200 options to be able to set, and the new ones are actually rechargeable through the skin. The old ones actually only lasted a few years because the battery pack was not rechargeable. How well do they work? Well, there's been numerous studies done on behalf of their effectiveness. 84% see a great improvement in quality of life. Over 3/4 at 77% have good to excellent pain relief. There has been a recent study on diabetic neuropathy where 85% of patients experience substantial sensation recovery, and over 3/4 has significant pain relief. So for those who have diabetic neuropathy and are losing sensation while also having pain at the same time, these are an amazing device. Okay, New England Journal of Medicine study showed that for RSD, spinal cord stimulation works extremely well too. You can see how small these newest battery packs are. This is a quarter, and this is just a little bit larger. So they're really small, they're thin, but yet they work much better than they ever have before. This is what the paddle leads look like that go around the spinal cord. You can see they have several, it's a silicone device with these implant looking diodes that all the programming goes through. Okay. The risks of an implant, one is that the device can stop working after a few years. That's the benefit of having over 200 programming options, is that you can change those around to try and make it work better and better. These things can migrate. Okay, there can be an infection, bleeding, wound breakdown. Overall, the complications are less than 7-8%, but these things do happen. Okay. The top non-operative pain management in California is with those clinics affiliated with the California Pain Network. There are several clinics throughout the state, including all the way from San Diego up to San Francisco and in between. Over 50 insurances are accepted, with over 25 treatment options being offered and an average success rate of over 90% for all conditions. The pain doctors are board certified, award winning. Visit us today online at californiapainnetwork.com and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Green with the California Pain Network. Your pain stops.